It is very true that and self-evident, really, that the healthcare system is very distressed and going through very hard times. The pattern of disease and hence the demand of healthcare has grown so exponentially that the system finds itself extremely overloaded. For instance, if you go back 2004, South Africa had 400,000 people on ARVs. Today we have got 4.2 million. It increased 10 times. But this was not met by a concomitant increase in the number of staff or even the number of facilities and equipment. That doesn't happen really because the increase of this tenfold increase happened within a very short space of time of that period, as I'm saying, of 10 years. So this has resulted in very long waiting times in most of the facilities, and of course the lowering of quality in others, in some of them. But as far as we know, this healthcare system is still able to provide treatment to the largest number of HIV positive people globally. As I have already said, our HIV/AIDS program is the biggest in the world at 4.2 million people. Our public health system is still able to treat all patients who suffer from TB, all 300,000 of them who are on treatment. And you are aware that in South Africa, TB is only treated in the public sector and nowhere else. We are still able in the public healthcare system to take care of 1.06 million women out of the total figure of 1.2 pregnant women. And to make sure that we are adequately taking care of them, we have registered them on a system called Mom Connect. The theater which I knew were leaking was in KZN in October last year due to flooding. But we have taken over those patients who need theater care to Nkosi Albert Luthuli, to Kindini Zulu Hospital, and to St. Aidan's. And we are busy repairing the theaters in King Road Hospital, which is very old. But the issue of drug stockouts surprised us because in 2014, we launched a new technology together with the Vodacom Foundation. That technology is called SVS, or Stock Visibility System, which is helping us to monitor stocks in our clinics while we're sitting right here in Pretoria. And we do so every single week. We have a biggest problem of human resources, which we cannot deny. It will be very foolish for us to deny it. Because after all, while sub-Saharan Africa carries 80% and more of all infectious diseases in the world, it has got only 3% of human resources for health in the world. And South Africa is not exempted from that. And I want to announce that before the end of this month, we will have advertised the first set of critical posts in Northwest. We will advertise 223 vacancies at the cost of 150 million rand. I've made it known to Gauteng that no matter how tough it is, we cannot afford not to fill vacant posts in health, especially those at the cold face of delivery. We will also help KwaZulu-Natal and Gauteng with their radiation oncology backlogs, which has been in the news. This program to deal with cancer in South Africa, which has also exploded, will be launched early in August this year. We are also painfully aware of poor management skills in most of our provinces because of wrong employment practices. As from today, as I'm sitting here, we are deploying 200 officials from head office. And we believe senior people from head office should no longer sit in their offices, must go to the ground and see why hospitals and clinics, for some reason or the other, are failing to put up good planning